How is familial hyperlipidemia inherited? Have you ever wondered how familial hyperlipidemia is passed down through families? This condition, particularly familial hypercholesterolemia, is inherited in a specific way that can impact cholesterol levels and heart health. Understanding this inheritance pattern is essential for anyone concerned about their cholesterol or family history of heart disease. Familial hyperlipidemia is primarily inherited in an autosomal dominant manner. This means that if one parent carries a mutated gene related to cholesterol metabolism, there is a significant chance for their child to inherit it. The most commonly affected genes in this condition include the low-density lipoprotein receptor gene, apolipoprotein B, and proprotein convertase subtilisin/kexin type 9. When a child inherits one altered gene from an affected parent and one normal gene from the other parent, they develop what is known as heterozygous familial hyperlipidemia. Individuals with this condition typically have low-density lipoprotein cholesterol levels that are 2 to 3 times higher than what is considered normal. There is also a 50% chance that they will pass this condition on to their children. Now, if both parents have familial hyperlipidemia, the situation changes. In this case, the child has a 25% chance of inheriting two altered copies of the gene, one from each parent. This leads to homozygous familial hyperlipidemia, which is a more severe form of the condition. Individuals with homozygous familial hyperlipidemia can have low-density lipoprotein cholesterol levels that are 3 to 6 times higher than normal. This can lead to early cardiovascular disease, sometimes even appearing in childhood or before birth. There is also a rarer form of familial hyperlipidemia that is inherited in an autosomal recessive manner. This occurs when a person inherits two altered copies of the gene, one from each parent. In this case, the parents usually have normal cholesterol levels and do not show any symptoms. Understanding how familial hyperlipidemia is inherited is important for early diagnosis and treatment. Since this condition leads to significantly elevated low-density lipoprotein cholesterol and increases the risk of premature heart disease, family members of affected individuals should consider getting screened. Early intervention through lifestyle changes and cholesterol-lowering medications can help reduce the risk of serious health issues related to high cholesterol levels. So, familial hyperlipidemia is most commonly inherited as an autosomal dominant disorder. Just one mutated gene copy is enough to cause the condition, and the severity can vary based on whether one or both gene copies are affected. This knowledge can be a game changer for families dealing with cholesterol issues.